and I am going to share my screen. So please let me know when you are able to see the practice in pregnancy orientation. I see the thumbs up. Thank y'all. Let's go ahead and move into it. Welcome to Full Circles Practice in Pregnancy Orientation. I'm your host, Dr. Adams, and I will be sharing a lot of things with you today. So just giving you a second to get all your notes together, because obviously this is live, so you're able to ask me lots of questions in real time. A couple of housekeeping things first. This is confidential. So please feel free to ask questions. No one's going to know that it's you. If I think that it is a question that's too personal and maybe people will know who you are, then I'll say, let's just hold that until your visit. So participate. There won't be poll questions today because Zoom is trolling me. And if you have to hop off at any point, this is going to be about 45 minutes to an hour or so. Just know that the presentation will be available on our YouTube channel afterward. Okay, so today we're going to be going over the full circle experience, which includes where we deliver. We're going to go through some office protocols, like how best to reach us. We'll talk about what to expect at each of your pregnancy visits. I'm going to give you a ton of prenatal resources. We will go in depth into exercise and nutrition in pregnancy, and then wrap up with an upper respiratory illness update. So first, a little bit about our practice. This is a collaborative midwifery model practice, which operates under the auspice that pregnancy and birth are normal. There are life processes. This is physiologic. It's what our bodies have to do in order for the species to survive. It's not a disease we have to cure you of. In the traditional model, they also care for normal women who are low risk and no issues. But if you develop any problems with your pregnancy, you may have to transfer out of midwife care in order to deliver. In the collaborative model, it allows you to stay in the care of the midwife with physician direction. So to that end, most of our labors and our deliveries are attended by our certified nurse midwives. And we deliver at a facility where midwives are also the laborists there. So no matter who is at your delivery, our primary goal is that labors and deliveries are attended by midwives, because they are the ones who do normal physiologic birth. Now, if something happens that's outside of their scope, they consult us during labor. If it's urgent, like it can wait 15 minutes, 20 minutes, not something to be scheduled for tomorrow, they call one of us in and we will assist with the delivery, whether it's vacuum, C-section, turning a baby, that sort of thing. But if it is emergent, like we don't have 15 minutes, there are board certified OBGYNs who are in-house 24 hours a day to take care of true emergencies. And to put emergencies into perspective, we did about 600 births in 2024, and 4 times we needed the hospitalists and 3 of those times were because the baby was coming out and the hospitalist made it to the room before the midwife did. So just know, now the hospitalist is a midwife too. So either way, you'll still have a vaginal delivery. And then there was one real emergency that the doctors came in and finished up. We deliver at HCA, which is not far from our office. And we've been there since October of 23. It's been an amazing move because the facility really had most of their OBs retire, and it just left this wide open space that they just remodeled, and it was open for us to come in and have them to add in labor tubs and wireless monitoring and squat bars and all the wonderful things that really allow people to be low intervention if they are truly low risk. If you'd like to see the facility, I highly recommend it. They throw a party 4 times a year. They're called the Stork Tours. So there are quarterly Stork Tours. When you come in for your visit, you will see this colorful flyer in the room. The next one is in May. So everyone on here, you're welcome to sign up for the next one, or you can wait until the next quarter. If the dates on there don't work for you though, just go to the HCA website and you can click on register for a class, and then you'll select labor and delivery tour. That's the name of the class. But their childbirth educator does these tours twice a month. So if you're not able to make the Stork tour, there are other opportunities to come and see us. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch between 1 p.m. and 2 p.m. So if you call, you're going to get the message, you reached the after hours line or you called us during lunch. The phones are not broken. The reason why we do that is because during lunch, the phones roll over to our emergency on-call provider, the one who's in the hospital. So if you're having a medical emergency, you're still able to reach someone during lunch. We reopen at 2 o'clock and then we close at 5 p.m. So if you are calling during lunch with something administrative, please don't leave a message on the emergency on-call line because she does not relay those messages back to the front desk. Wait until 2 p.m. and you can reach someone at the front desk by pressing 0. If you are calling on a Friday, we are open at 9 a.m. and we close at 1 p.m. So if you're calling with something administrative at 12:54 on a Friday, then that message may be returned when we reopen on Monday at 9 a.m. For appointments, we do not have walk-in appointments. Our goal is to see you at as close to your appointment time as possible. And if I promised you the 10:20 slot and someone else walks in at 10:13 and says, I need to be seen right now, well, that's pushing into your slot and that's not fair to you. So we try to respect your time and see you on time. And the same thing for everyone else. We ask you to respect your fellow patients. We do have limited same-day appointments. There are times people deliver, cancel, forget, or late, whatever, and spots open up. So if you are calling in with a concern in the morning and we say, oh my gosh, yeah, look, we have an 11:40, we'll bring you in to see Brianna for that. If we don't have a spot though, some days we are completely full and you're saying, I really need to be seen, we might recommend that you are seen on labor and delivery because we're there too. Or if you're calling with something urgent, like if it's 9 a.m. and our next appointment is 3:20, but you're not feeling your baby move or you're bleeding, we're not going to have you sitting in our lobby waiting to get worked in for 6 hours. Urgent care matters require an urgent setting. So if we're saying we need to see you outside of the office, it's not because we don't want to see you, it's because we want you to be seen actually in a timely fashion. When you call, the providers are not able to leave patient appointments to take phone calls, again, because we promise you your time and it's not fair for us to leave your appointment to go talk to someone else. Same deal if you're calling, we're talking to someone else, and we have nurses who can take clinical messages and they can get back to you with the response. If it's something you can't wait for a response for, that's something emergent and you may need to go and be seen on labor and delivery. When you call, though, you do have to leave a message in order to receive a call back because people will call and hang up and call and hang up and call and hang up. Remember, if you're trying to reach the front desk, you listen to the entire message and at the end it says press 0. If it's something administrative, please contact Jennifer or Kylie here because they take care of letters, forms, and nurse calls. And the OB clinical coordinator, Naisha, is here for referrals. She coordinates labs, scheduling, deliveries, that sort of thing. If it's administrative, Renee Hall is our benefits coordinator. If there's something about your insurance that changes, please keep us in the loop about that because she's the one who will help walk you through those things. After hours, you just dial the same number that you would normally call. But after, as I said, it rolls over and there's always someone from our practice on call for our practice. And this is who you call if you think you need to go to the hospital. So you have to leave a voicemail message for the phone to even register that a call came through so that she can call you back. The patient portal is also a way to reach us, but do remember that response times can take up to 2 business days. As soon as you hit send on the button, it says, please know that this is not regularly monitored. You're not texting us directly on our phones. We have to log in to our work electronic medical record system in order to see our message. And it can take up to 2 business days. If it's not an action item, like you're asking, oh, can I take this vitamin or use this, whatever, that may be something that we pass on to the person who is seeing you at your next appointment. And then the portal is probably best used for things like, I lost my lab slip, coming in for a visit and I need to go to the lab, can someone email me another one? Or I've got an upper respiratory infection, I want to convert my appointment to virtual. As long as there's 2 business days between whatever it is you need, let us know. I've sent people letters for a dentist, massage, that sort of thing. That's what the portal is good for. Please do not use the portal for urgent matters. Like if your blood pressure is elevated, you're not feeling your baby move, you're bleeding heavily. The portal is not for that. That is a phone call to the emergency on-call person so she can walk you through it and tell you who need to come in. We do ask that you don't send blitz messages. So blitz messaging is when you write a message to someone and then you copy and paste it to the other 6 or 7 of us too. Multiple messages to one provider and or to different providers is actually abusing the portal, because remember, this is what we do after we've seen patients all day, completed all our notes, reviewed all our ultrasounds and our labs. This is our family time. If there's 1 or 2 other things that we can do to help, we'll do them, but we don't want to do multiple visits in the portal after hours. Text yourself questions if you have questions that require anything more than a yes, no, or sending something to you, or schedule an appointment. We're happy to see you in the office during business hours to answer any of those questions. Ultrasounds are also released over the patient portal unless there is something urgently abnormal that is seen on the ultrasound. In that case, we will break our schedule. This is our one exception. And someone will come and talk to you about what we found on the ultrasound and what the next plan is. It'll typically be coordinating something with Naisha to get the high-risk doctors involved. Otherwise, we don't get the reports on the same day the ultrasound is done. Our sonographers have a collective, probably 50 years of experience between the 2 of them. And they complete their reports. If they see something that they're like, she shouldn't really walk out without talking about this, they know how to grab us so we can come talk to you. Otherwise, they complete their report, medical assistants upload it to our electronic medical record system and divide it between us so that we can review it and send it out to you. So give us two business days to review them, to receive them, review them, and respond. Now, if you know that your anxiety won't allow you to wait 2 business days to know what's on your ultrasound report, then please schedule an appointment with a provider on the same day as the ultrasound visit, because the text can also print out a preliminary report and you can go over it at your next visit. Quest and Natera also have portals. And by something in the Affordable Care Act, they have to send the results to you at the same time as they send them to us. Y'all get the results and you see all the red on the page and it freaks you out and you start Googling and chat GPTing. So first thing, red doesn't necessarily mean abnormal. The reference ranges that they're using are for non-pregnant individuals. Pregnancy changes a lot of things physiologically, and some things are normal in pregnancy that look out of range for someone who's non-pregnant. So please do not upload your labs and ask us what all the red things are about if you see them on Quest or Natera first. Give us a chance to receive them, review them, and release them. Now, if you've had your results for a week and you haven't heard anything from us, then do let us know. Like, don't send them to us, but just let us know that the results are in, because then we need to reach out to Quest so that we can close our order loop and make sure that we know that the results are in place. The most common reason, though, that we don't receive labs from Quest or another place is if you're using a different name at a different facility. So we do request that whatever name you're using with us, hopefully it matches your insurance information, but please use that same name every place. Sometimes we just haven't gotten around to changing our names in marriage and that sort of thing, but alternative name use guarantees delays in us receiving your labs. There are no fax machines here. Everything goes to Massachusetts and gets sorted by name and date of birth and demographics. So if you're Susie Smith here and Susie Johnson there, it's not going to go into your chart. All right, moving on to what to expect at our visits. 1, expect that you are going to forget every question that you had the whole 3 or 4 weeks that you were away from us. So start a text thread with yourself with all of your questions that you want to ask at your visit. My favorite thing is when we get to the end of my part, I check blood pressure and baby and everything, and then I ask, all right, do you have any questions? You say, yes, actually I do. And you pull out your phone and start finding your text thread. We want you to wear loose, comfortable clothing so that we can access your belly. We want to check baby's heart rate at every visit, not an ultrasound, but a heart rate check with the Doppler. And we'd like you to get here about 5 minutes before the visit is scheduled, so you'll have time to check in and handle any insurance issues at the front desk, and leave us a urine sample if you need to. Not everyone needs to leave them anymore. We used to check them on everybody, but now it'll typically be people who have had blood pressures. We're watching and looking for protein in your urine, elevated blood sugars, and we're looking for glucose, or if you've had a recent urinary tract infection, and we're checking to see if the treatment has worked. The next question I have is, how long should we expect to wait for in-house lab results? It's a good question. So it depends on what the result is. So if you did genetic testing, that's usually somewhere, if it's the NIPT is about 2 weeks, the carrier screening is somewhere between 2 and 3 weeks. Usually regular labs are within about 5 business days. Good question. For your visits, if you're 10 minutes late, we still have time to check on you and your baby. It obviously leaves less time for our text thread question session. If you're 20 minutes late, that is the entire appointment slot, and we may be able to work you in a little later in the day. Like I said, sometimes there are openings where other people have canceled or dropped off of the schedule. If there isn't another time that works well for you, we can just reschedule to a time that works well for everybody. Diagnostic ultrasound visits. So remember that these are separate from prenatal visits. How do you know whether you have an ultrasound scheduled? Great question. Do you have more than one appointment time? And is there a provider's name associated with your visit? So Tina Test is my imaginary patient, and when she logs into her portal, she clicks on appointments, and Tina sees that she has 2 appointments on the same day. The first one is at 9:20 with ultrasound, which is not a provider's name. The next one is at 10 a.m. with Dr. Yeckel, which is a provider's name. So Tina knows that she has an ultrasound scheduled, and afterwards she can go over preliminary report with Dr. Yeckel. She also knows that her full report will be sent to her portal within 2 business days unless there is something urgently abnormal, in which case she will have the findings discussed with her on that day. So when you're checking out from a prenatal visit, please let the front desk know if you need a prenatal visit and a diagnostic ultrasound. Remember, they should be scheduling more than one visit, and it should show up that way in your portal if you have an ultrasound due. If you want to look at your baby more than medically we need to, boutique ultrasounds are a thing. These are a couple of places in town. And just for informational purposes, there's one in St. Augustine too. But these places will do just quick little, sneak peeks at the baby, check the heart rate, look at, they do 3D. We don't do 3D ultrasounds here, but they do 3D. They'll put the baby's heartbeat in a stuffed animal. It's very cute. Lots of stuff. All right, so we are not going to do a poll question. We are going to move to the website. So let me know if you are able to see Full Circle Jacks, the website. Give me a thumbs up. Not sure if I'm sharing the right one. Okay, very good. All right, this is fullcirclejacks.com. So the next part of this is all stuff that you can find on our website. Let's start with who we are. All right, so the providers. There's me popping up with more hair. There's Dr. Marrow, there's Dr. Yeckel, Dr. Mooney. We also have the midwives. There's midwife Lauren, midwife Krista, midwife Cindy. I'll come back to Vanessa. Midwife Norma, Kayla, midwife Jordan, Brianna, and Jackie. And a lot of people here. So chance to meet as many people as you possibly can, because we rotate call and we don't know who's going to be on when you actually deliver. Vanessa is our PA. She's not a midwife, but she does do some prenatal visits, fills in, if we're short on midwives sometimes, but she also does our belly birth moms because she scrubs into belly births, which is our word for cesarean deliveries. Over here under patient information, you'll see the obstetrics tab. And the first thing on here I want to point out are our stats. So just remember that our delivery stats, we're very transparent with our numbers. Some years are better than others. Last year was a good year. And this is, what are your chances of labor converting into a C-section? What are your chances of a successful vaginal birth after cesarean? So all the way back to 2018, you can see how our report card stacks up. Let's look at the prenatal care timeline. So this is what to expect at each visit. So everyone on here has already done their confirmation visit, which we like to do between 8 and 10 weeks. That's where we do your ultrasound, set your due date, you meet with the midwife and talk about anything urgent. After that, you have a virtual visit with me, not here on Zoom, but on Doxy. You have a virtual visit with me where I go over your medical and your pregnancy history. You've already done your insurance prepayment plan with Renee Hall. After you see me is typically when I order blood work. So your standard prenatal blood work is all listed right here. Again, also transparent about what labs we order. If you decide to do genetic testing, that's your first opportunity to find out if it's a boy or girl. You have to be at least 10 weeks to get that done. And so we'll get that ordered for you as well. If you opt out of genetic testing the first time to see if it's boy or girl, will be at your anatomy ultrasound with us, or you can sneak peek with one of those other places. At this point in pregnancy, we are seeing you every 4 weeks in the office. So roughly 4 weeks after your confirmation visit, you're coming in for your OB physical. And the OB physical includes cervical cultures, it's heart, lungs, breast exam. It's a physical exam. It does not necessarily include a Pap test. The Pap is not part of the ACOG, American College of Obstetricians, panel for prenatals. If you would like to have a Pap done at this time, you're more than welcome to, but it's not required. You and your midwife can discuss that at that visit. If you have a high risk issue, typically we'll identify it when you and I talk in our virtual visit, and usually the high risk group starts to see patients around 12 to 13 weeks. Then about 4 weeks later, we're seeing you back in here for just a regular second trimester checkup. Not a whole lot done there. We talk about normal second trimester changes in the body, round ligament pain, starting to feel the baby move. That's cool. And then at 20 weeks is when we do the anatomy ultrasound. If you have twins, we do it a little bit earlier, 18, 19 weeks or so. But 20 weeks is typically when we're scheduling anatomy. And that's when we're looking at baby's brain structures, kidney structures, heart structures, all of that good stuff. And if baby's cooperative, we can see if it's a boy or girl. If you meet with a midwife around this time, she'll be talking to you about starting childbirth education and or breastfeeding classes. It seems early, but a lot of these classes are like 6 to 8 weeks, and they may not start right then. So if you don't start your class until 28 weeks or so, you might not finish until 34 weeks. And we want to make sure that you get all the information you need before your baby comes. So about 4 weeks later is when we do the glucose test. And I know I'll have questions about that, so we'll come back to it in a little bit. My moms who have a certain blood type, if they are Rh negative, we want to make sure that we have RhoGAM to give you if you need it around 28 to 30 weeks. And we talk to our Rh negative moms about what that means and why. This is when we want you to pre-register at the hospital, do a tour. All the information to pre-register for the hospital is online, and we'll give you that information to the QR code to scan and register. If you're planning to work with a doula, and we'll talk about doulas in a little bit too, you definitely want to have her selected by the 3rd trimester. Most of the doulas are telling me, can you tell people to start calling us in 1st trimester? So I'm going to move that around a little later on. Then we move into 3rd trimester. So this is where we start seeing you every 2 weeks. You'll see here in the middle, there's an option to repeat or decline your standard prenatal labs. The College of Obstetricians recommends that we do it at least once. Duval County Health Department recommends high-risk populations repeat it. If you feel you are not high risk, there is an option to decline repeating it. For those who intend to do their boosters or vaccination boosters, early 3rd trimester is the best time, because then you will build antibodies to passively immunize your baby during breastfeeding. First-time mamas, you want to select your pediatrician. Veteran mamas, you want to decide if you're staying with the same pediatrician, because once the baby is out, he, she, or they are going to need their own doctor, because it will not be me. I'll still be your doctor, but once y'all separate bodies, you separate doctors. All right, so people who have an additional concern with pregnancy, like high blood pressure or diabetes, we start doing additional testing on you around 32 to 36 weeks. If you're planning a belly birth, around 33 weeks is when we start to get your date on the calendar so that you can begin planning that. Typically, our belly birth moms are off the train between 37 and 39 weeks, depending on your particular circumstance. Most are at 39 weeks. Then at 36 weeks, we start seeing you weekly. This is when it ramps up. So one more pelvic exam, we screen you for group beta strep, which is not an infection, but it's a normal bacteria that we'll be discussing with you about why it's important and what happens if it's positive versus negative. And if you opted out of repeating your STI screening early in the trimester, you can opt out of repeating STI screening for culture. So as I said, we start seeing you weekly. So You're full term at 37 weeks, full term. So if you are wanting to do a birth plan, this is the time to bring it in and talk about it, because now at full term, all these things are typically on the table. You start your natural cervical ripening methods, our belly birth moms, exit stage left, those who are waiting for baby to give the signal to start labor are being patient and patient and patient. And then our preference is, because the rate of stillbirth increases drastically after 42 weeks, to have all babies delivered by 42 weeks. So for first-time moms, we'll usually schedule your induction 41 weeks and 5 days. For veteran moms, 41 weeks and 6 days. First-time moms, your average length of labor is about 24 hours. 24 hours. Second-time moms, whatever your first labor was, it's usually about half that. Next question I have is, can the midwives perform stitches? Yes, midwives can repair first degree and second degree lacerations, but if you have an advanced laceration that includes the anal sphincter or rectum, then they call the physicians and we repair those. Good question. Next question is diagnostic ultrasound different from a regular ultrasound? Might be a basic question. There are no basic questions, but I wanted to be sure I understand. So it's diagnostic because we're doing it in order to find if everything is okay, or if there's something that we need to watch out more closely for. The regular ultrasounds, like the fun ultrasounds at the boutique, like, they're not allowed to tell you anything, but I will tell you that a lot of the people who run those boutiques actually have done high-risk ultrasounds before, and I've gotten phone calls from them if they see something that's abnormal, because they can't say anything to you. So if you do go to one of those places, be sure you tell them that you go to Full Circle. They'll ask you who your doctor is. But they do regular fun ultrasounds, and we do diagnostic, looking at different body parts to see if everything is where it's supposed to be. Good question. Next, pregnancy safe medications. So this is an alphabetical list of all the discomforts and things that go with pregnancy that nobody really talks about. Constipation, diarrhea, fatigue, gas. Pregnancy is so sexy. Anyway, first thing that we're going to recommend that you do for all of this stuff is here in the middle, the relief measures. So some of y'all have gotten real slick. You send me messages in the portal and you say, Dr. Adams, I've tried everything on the safe medications list. What else can I do for insert issue here? Because if you send me a message, the first thing I'm going to say is with a link. Have you tried everything on this list? So if you have tried everything on this list, then definitely reach out to us, because it may be time for either an evaluation in the office or prescription answer to some of these things. Do be careful of the caveats we have on here. If you're nauseous, if you're vomiting, if you can't keep down fluids for 24 hours, please don't keep trying C-bands and ginger. Call us, because dehydrated you is not good for baby either. Okay. Next, I have the gestational diabetes screening test. I said I was going to come back to this. This is not the time I'm coming back to it, but I'm letting you know that this is out there. This is information that you will need when you're around 24 to 26 weeks and ready to do the glucose testing. So I'm going to refer to this a little later on, but just remember that this document is out here. You don't need it today. You'll need it in a couple of months. Question I have on the floor is, do you do glucose testing in office, or do you need to go to Quest? For the 1 hour test, we do that in the office. But if you don't pass the 1 hour test and you need to do the 3 hour, then we send you to another facility. Weight gain in pregnancy. The question is, how much weight am I supposed to be gaining in pregnancy? Great question. It depends is the answer. So you click on this link here, you put in your pre-pregnancy height and weight, and it will tell you what your pre-pregnancy body mass index classifies you as. And then you look at your recommended weight gain in pregnancy. But what I really want to highlight is that these rates of weight gain in the second and third trimester are in the second and third trimester. In the first trimester, nobody has an appetite, everybody's nauseous, nobody wants to eat anything, and you might lose a couple pounds. That's okay. Second and third trimester, pounds per week, is where we want to see your gains. Or first trimester, you're in survival mode and all you're eating is carbohydrates and you put on some weight. Please slow down, because that still will count for your total weight gain for the whole pregnancy. Okay. All right, and remember, good carbs, because craving carbs doesn't necessarily have to mean the stuff that puts on all the extra mommy weight. Birth preferences. So remember I said after 37 weeks, if you want to start working on your birth plan, here it is. So these are some things, especially for first-time moms. I didn't get to do my poll today, so I don't know how many first-time moms I have. But this is, if you've never done this before, it's kind of hard to start making, decisions on what you want to do. You don't even, like you've never done it. So this kind of breaks it down into smaller bites, everything from how you want labor to start, what you want to wear in labor, how you want to be monitored. Nothing on here is dangerous. These are all matters of personal opinion. There are no wrong answers on this page. So just some things to point out. Obviously, it's a hospital, so we have epidurals and IV pain medicine, but we also have hydrotherapy, tubs. You could labor in the tub to help with some relief. Nitrous oxide is in the building, and we're still working on getting it into the patients. So bear with me. It's on here, but it's a not yet. Hopefully by the time y'all deliver, we'll be there. Other things are that we are not strapping you to the bed and starving you. We want you to hydrate. We want you to labor in different positions, move around, walk around, all that good stuff. You can push in different positions, deliver in any position. Our standard is perineal massage, slow delivery of the head, warm compresses to try to avoid tearing. We do delayed cord clamping, immediate skin to skin, all that good stuff. You can decide what you want to do with your placenta. These are the medications routinely offered to the newborn. Talk to your midwife about what each thing is for. Is it important to use? Do you need it? Does it apply to you? Things about circumcision, breastfeeding, twins. Twins have a lot of options as well. And then belly birth too. We do gentle cesareans here as well. So our moms who are having belly births, it's not, if I get a vaginal delivery, I get everything I want. If I get a belly birth, I don't get anything, and it's a terrible experience. There are such things as healing belly births. So remember that this is out here. Again, you can start working on it at any point, and then you just want to bring it in after your 36th week. Cervical ripening techniques. This is another thing that you probably won't need until 36 weeks. Sorry, this is midwife Lauren sending me a message now. So 20 weeks, you can start raspberry leaf tea. Everything on here is off of evidence-based birth. And you can see that it really ramps up after 36 weeks, and it moves all the way down to 39 weeks, membrane stripping, and all these things. And these are things, again, that you can talk to your midwife about as the weeks progress. A couple questions on the floor. What if a patient is put on Pitocin? Can they still move freely? Absolutely, because it's just an IV infusion, and you're still able to get up and walk around. Next question is, do the providers perform the circumcision? The physicians do the circumcisions here in the office, and I'll talk about that in just a minute too. All right, where are we? Oh, first-time moms and trial of labor. So again, usually I have a poll here to find out if I have any VBAC moms on here. So if anyone's on here who's had a C-section before, and you're trying for a VBAC, then please know that this is for you. And first-time moms, you listen too, because you are trying to do the same thing that they are, and that is avoid an unnecessary C-section. So control what you can. Babies are going to baby. They are going to do all sorts of things to sabotage your wonderful plans of whatever kind of birth you're looking for. You can't control that. What you can control is what position you have gotten yourself in to allow baby to descend into your pelvis appropriately. I will tell you, the most common reason we are doing C-sections is not because babies are too big or because babies are in distress. It is because babies are sunny side up, not breech, sunny side up. So the head is down, but the spine is facing your spine. You want baby's spine to be toward your abdomen. A first-time mom or a VBAC mom with a spine facing your spine, your chance of vaginal delivery across the board is about 15 to 20%. So all of these things help to get your baby to descend in the pelvis in the right way. Squats we'll talk about in just a moment. Watching the weight gain, having an experienced doula. Don't cheap out on the doula. First-time moms, don't get exhausted at 39 weeks and say, just get the baby out, because our goal is to avoid an unnecessary induction, which may lead to an unnecessary C-section. So please trust us. Our stats are very good, and we're not looking to mess them up by messing up your birth either. Lastly, circumcision, for that question that I just had out there. We perform them in the office before little guy is 10 days old. We do have to have the vitamin K injection prior to circumcision, and that is given during the hospital stay. Oral is not a substitute. They do have preservative-free vitamin K at the hospital, though. You just have to let them know that that's the one that you want. And this is information on how to take care of the circumcision afterward. So just remember, all this is in the obstetrics tab under patient information at Full Circle Jacks. Okay. All right, so now we are going back to our presentation. And you can see that sometimes when all we had was coffee, it's a little bit more than coffee. And sometimes what we actually have was a salted caramel mocha monstrosity with 570 calories. It's like a full meal. Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain a pound of body weight. And remember that document, your goal weight gain is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories net to maintain that. If your goal is to gain 25 pounds, you get an additional 250 calories for a total of 1950. We divide that by breakfast, lunch, and dinner. 650 calories a meal. If you're eating 650 calories per meal, do not wash it down with a 570 calorie mocha monstrosity. Your baby does not know the difference between eating or drinking your calories. They will take their 300 off the top, and then you get to keep the rest. Mother's Day is coming up. I'll tell you, that's your first Mother's Day present. This slide talks about where those calories should come from. Just kind of a high level overview, just what percentage of your calories should be coming from fats, what should come from carbohydrates, what should come from proteins. The second part of the slide just shows how little changes can make a difference. So changing from traditional spaghetti sauce to 20-minute herb-infused marinara can cut 500 milligrams of sodium in one serving. When your rings start getting tight in third trimester, you're going to be looking for ways to cut sodium. So what things should you be eating? Fruits, veggies, whole grains, cereal. You will not give your baby a nut or dairy allergy or sensitivity by eating those things, so please enjoy. For my coffee drinkers, you want to keep your caffeine down to less than 200 milligrams a day. Now remember, if there's something you need to put a limit on, there can be an adverse reaction to it. So some people, even at amounts less than that, it can create irregular heartbeats in the baby. So if you can drink less caffeine, drink less caffeine. It is also a diuretic, so I tell people use the 3-to-1 rule. You want to drink 3 times as much water as whatever caffeinated beverage you are taking in. Herbal teas are fine. These are our favorites. Raspberry leaf, as I mentioned on the other slide, but ginger, lemon, and peppermint. For my vegetarians, pescatarians, protein, you want to keep your protein around 70 grams a day. There are some pregnancy diets that tell you to take in about 125 grams of protein a day. That's a lot. You will grow a 10 or 11 pound baby with that. 70 grams is a really nice sweet spot for appropriate protein intake. Twins can add about 20 more grams to that. Deli meat, yes, you can. You can, as long as you microwave it for 30 seconds to kill any harmful bacteria. If your soft cheeses are made with pasteurized milk, they're fine. So you're buying it from Trader Joe's, flip it over. If it says pasteurized milk, you're okay. If you are if you're not sure, like you're out at a restaurant, you can't tell what the soft cheese is made with, don't eat it. You can't tell. Canned tuna, you can have 3 4-ounce cans per week. The question I have out here now is, does your office recommend a specific birthing method? Not a specific method, but I actually am going to give you some resources for a few methods coming up. Good questions. Y'all are a good group. If you are a pescatarian and you have questions about things you can eat other than canned tuna, the FDA has a really nice document out there about what fish you should eat in large quantities because they're high in DHA, which is good for baby's brain development, which things you should eat in moderation because they're just kind of neutral and just more and more protein, and which things you should eat sparingly or avoid because they're higher in methylmercuries. So it says October 2021, but that's the latest iteration of this document. document. You just want to avoid undercooked meats and fish. So if you're like a foodie like me and you like your steaks medium rare, you will need to ruin your steaks for the next 6 months and eat them well done. Same thing with that yummy ahi tuna fish. That's not for you. You get the fried sushi for 6 months. Sorry. Kombucha drinkers, kimchi eaters, sauerkraut. These are all fermented things. So limit your intake because your body can treat it fermented like an alcohol. In that same vein, you want to stay away from alcohol because we do not know how much alcohol is required to create fetal alcohol syndrome. And you want to keep your sodium under 1,500 milligrams a day. So again, remember that herb infused marinara, you cut out 500 milligrams right there. Again, ring swelling, big deal. All right, questions I have here on the floor. 1, my husband is convinced I cannot eat lobster, but I heard it was okay. I just want to check the facts about that. As long as it is cooked all the way through, it is fine. You can enjoy your shellfish. Next question, on any guidance on protein bars. Are they an okay source of protein? Yes, absolutely. Again, you just want to look at your total protein intake for the day and be sure that they're not pushing you over an edge. All right. Exercise. It is fine for you to continue whatever your pre-pregnancy activity was, unless your pre-pregnancy activity was doing nothing. You just won't feel like it in first trimester, and that's okay. In the second trimester, your blood volume increases by 50%. You get more red blood cells. That's going to help you do more aerobic activity, and you'll just feel better. So just listen to your body. If you weren't doing anything before, it is okay to start a new regimen. So do remember that sedentary lifestyle leads to malpositioned babies, which leads to cesarean deliveries. So getting out and moving around helps your baby to descend in the appropriate position in your pelvis. For those of you with these, the biometric watches, you'll notice that your resting heart rate is going to go up by 10 to 20 beats per minute. That is normal. That is a physiologic change of pregnancy. As long as you're not getting dizzy or lightheaded with it, that is what your body is supposed to do for your increased cardiac output. If you are walking for exercise, remember that when you walk, your heart rate needs to be in the aerobic zone, which is 70% of your max heart rate. Your max heart rate is based on your age. So we start with 220 as the max for everybody, and then you subtract your age. So if you're 30 years old, you should not be exercising for extended periods of time with your heart rate above 190. 70% of that, though, is where your aerobic zone starts, so 133. So if you're walking, your heart rate needs to be between 133 and 190 for 30 minutes, 3 times a week. That is aerobic activity. If you're walking for exercise and your heart rate is still hanging out between 80 and 100, where it always is, that is transportation, because walking is transportation, but it's not aerobic exercise. So how do we get the heart rate up? We can do some cardio. The treadmill is fine. Elliptical is good. Running, swimming is actually my favorite, and y'all are my summer crew. Y'all will be pregnant when it's hot, and you can swim. It makes your belly weightless and your ligaments don't hurt. Indoor bike is fine. Weightlifting, you can lift up to whatever you were lifting pre-pregnancy. You don't need to add resistance because your baby and your body are going to do that. Squats are my favorite. Please, if you're not an experienced squatter, start. 20 weeks, give me 5 a day. 21 weeks, give me 10 a day. 22 weeks, 15. We're building up to a minimum of 50 squats per day. If you are already an experienced squatter and doing more than that already, go for it, please. Again, anything that helps to get that pelvis open, those muscles long and lean, and let that baby descend in the right position. Pilates and yoga are also 2 of my favorites, and any experienced instructor will be able to tell you what the pregnancy modifications are. Things you want to avoid: high intensity interval workouts after first trimester. And it's not the interval, it's the intensity. You can still do the low impact version of these exercises, but any sudden jerking movements, we don't want to accidentally shear the placenta off the side of the wall of the uterus. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, you want to limit your avoid hot yoga until you're not pregnant because you'll get dizzy and fall, and don't want you to fall on your belly. Scuba, you want to avoid because changes in barometric pressure alter the oxygen to the baby. Same thing with high altitude hiking. You can visit family in high altitudes. You got family in Colorado at 8 to 10,000 feet above sea level, go for it. Just don't go hiking with them. Contact sports, please do not pick up kickball or kickboxing during any of this. We've had some pickleball incidents. Anything with a ball flying towards you, maybe you want to hold off until after pregnancy. And then outdoor biking after 16 weeks isn't a no, it's a be careful, because your center of gravity changes at about 15 weeks, and as you go to turn corners, you may actually just kind of fall all the way over. We don't want that to happen to you either. So now that we have talked about nutrition and exercise, the question I usually ask here is, can you prevent gestational diabetes with diet and exercise? And the answer is no. You can manage it with diet and exercise, but preventing it is the reason why we screen everybody. Your number one risk factor for gestational diabetes is your placenta. The question that I have here is, I have a knee injury. Is there an exercise I can do other than squats? Yes, actually, that's something we should probably talk about at your visit and just see what modifications we can come up with for you. Good question. So back to the placenta. The placenta is both the hero and the villain in your pregnancy. So your placenta is always giving off hormones that alter stuff on how your body works. So insulin is a hormone, right? The job of insulin is to clear the bloodstream of excess glucose. Well, your placenta gives off hormones that tell insulin not to do its job. And so it creates an insulin resistance. You have all this insulin out here that's not doing its job. And so when it doesn't, it leaves glucose out in your bloodstream. Extra glucose in your bloodstream is diabetes, but it's gestational diabetes because it's your placenta's fault. So if you are doing this pregnancy without a placenta, then we do not have to screen you for gestational diabetes. But if you have a placenta, and twin mamas, if you have two, we definitely need to screen you. So my moms who say, but I don't eat any sugars, you eat good carbohydrates. So your fruits, your whole grains, things like that. Don't avoid them prior to the test. You'll give yourself a false positive. If the drink itself is what bothers you, we have options. So remember that document that I clicked on back on the website? I said you won't need this until you're 24 weeks. We have the Simply Pure drink here in the office. It is soy-free, it's dye-free, it's gluten-free, BBO-free, kosher, vegan, offensive to almost no one. There are additional patient-driven options, Glucorganics, the Fresh Test, glucose tablets. So just look on the website on the glucose document when you're around 24 weeks and let the midwives know. If you're planning to order any of those other things, you just bring them with you and she'll go over what the instructions are on taking those. Now, at some point, you will deliver. And so you want to be prepared for birth. And this goes to the question I had about whether we recommend any specific method. This specifically says we do not endorse any specific service provider. But what's represented on here are childbirth education classes that represent different methods. So one of these is hypnobirthing. One of these is Bradley method. One of these is hypnobabies. So you can, if you start Googling this, the internet algorithm will find you. Social media will start suggesting different methods for education. Personally, I did hypnobirthing, the Marie Mongan method, and that was very helpful for me. But all of these are fantastic. Breastfeeding classes, La Leche League has them regionally, and then our hospital has a fantastic lactation consultant, Sonia, who does an amazing course as well. Every new parent should know CPR. Here is a link to take a class for infant CPR. So even if you already know adult CPR, it's not just doing it with thumbs. There are different ratios and things like that. If you're already seeing a chiropractor, excellent. If you are not, be sure that if you start to look for one for things like sciatic pain or even helping with baby's position, breech, or sunny side up, be sure that he, she, or they are Webster certified. That's a special certification to account for the different changes in pregnancy and make sure that the adjustments are still safe. Question I have on the floor now. I walked for maybe 5 minutes and started bleeding the next day. Should I stay in bed mostly until the bleeding stops? Yes. Let's wait until the bleeding stops. You have plenty of time to get your exercise in later. Good question. All right, next. There's another question here. What are the odds of getting a midwife doctor from Full Circle? 100%. 100%. That's those only people that I'm paying to deliver you. Does HCA have other practices, and will we be subject to whoever is on call? Yes, HCA does have other practices, but they don't share call with Full Circle. Good question there. So yes, there's always someone from our practice on call for our practice. Preparing for birth. Doulas. So I don't know how many people, because again, this is one of my poll questions. How many of y'all are planning to work with a doula? I hope most of you, if not all. Because people say, wait, but I have a midwife, I have a doctor, I have a nurse. What's a doula for? So doulas provide emotional and physical support before pregnancy, during, and after. So in labor specifically, they help you with your breathing techniques. So whatever method that you decide to go with, be sure your doula is well versed in that so that she can help you remember your position changes and relaxation strategies during labor. They're not clinicians, so we're your clinical team. So we're giving medical advice and providing medical care, prescribing any medications, and doing the actual delivery. They are there to help you process your feelings and formulate questions and make sure you understand everything that we are doing in terms of, usually doulas bring patients to us because they know that they don't have to spend their time advocating, for us to explain things. But if there is ever anything that you didn't understand and you start talking to your doula about it and you're not clear, then she can help you, kind of formulate your conversation with us, and helps with birth plans and that sort of thing. Remember, your midwife is there, and she may have 3 other people in labor at the same time. Your doula is contracted with just you. She's in the room the whole time. Your nurse is going to change shift every 12 hours. Your midwife's going to change shift every 12 hours too. So if you are looking to work with a doula who is there for you, ask the midwives who they've had great success working with supporting our moms. Acupuncture and pregnancy massage are both amazing for sciatic pain. Acupuncture is good for nausea, back pain, and again, these things can help with baby's position too. Some places want a letter saying that it's okay to do it. So if you run into that problem, just let us know, and Naisha can help you with the pregnancy letter. Most of your insurances will cover breast pumps. So please scan the QR code that is in our rooms when you're around 20 weeks. So when you do your anatomy ultrasound, go into the room and scan our QR codes. This particular business, they just make it really easy. You put your insurance info in, they write the prescription for whatever pump you choose, and then we get to send it off. When people try to find their own places to facilitate this, it ends up in an endless spiral of messages. I sent it to them and they said they didn't send it to you, and can you send it, and can you write and they ask all sorts of questions and ask for us to fax. Right, this is very easy. Please just scan our QR code and you'll have your breast pump within a week or 2 typically. If anyone in the family needs to use the Family Medical Leave Act to be off for pregnancy bonding, we use Leave Guru. It's a third-party vendor. If you've ever tried to get FMLA paperwork filled out before, it can take several weeks to get it done. Most of these forms are getting completed in less than 24 hours, some in 10 minutes. So when it's time for FMLA, please let Kylie know, and she will connect you with Leave Guru. After you deliver, what does your postpartum care look like? Kind of depends on what happened during your pregnancy. So first, I will start with the questions I have. I have a dentist appointment coming up, and sometimes they require approval from the OB. Who would I need to advise to get that clearance? You send a message, and we will send a message with your dentist's information, and Naisha will send the letter to you or can fax it directly to them. Next is, if I'm pre-diabetic, will I more than likely fail my glucose tests? There is a pretty good chance, but we would still want to test you and just see where we are. We won't assume anything at all. When we go into labor, do we call L&D or Full Circle office? So please call labor and please, sorry, don't, that's the wrong answer. Please call Full Circle. We need to know that you're coming in. We'll call labor and delivery and let them know that you're coming in. So please call us so that we can make sure that that we are expecting you and that labor and delivery is expecting you as well. Blood pressure check. If you have any issues with your blood pressure during pregnancy, first time moms, 1 in 8 of you will have a blood pressure issue during pregnancy. And this is in people who have never had a blood pressure issue before, may or may not have family history of blood pressure problems, regardless of your body mass index, your salt intake, or whatever. It is the supervillain placenta giving off hormones again that elevate your blood pressure at the end of pregnancy. So if this happens to you, if you're part of the 1 in 8, then we will bring you back in the office a little sooner, usually within a week of discharge, so that we can check your blood pressure, because postpartum preeclampsia can be more dangerous than preeclampsia during pregnancy. So we keep a very close eye about that. If you had a belly birth, incision check, you're back in the office in 2 weeks. Routine mental health screening, 80% of women will have baby blues, which is just a little tearfulness right after delivery in the first 14 days. If it persists beyond that, or it's more aggressive than just a little tearfulness, we may be looking at postpartum anxiety, depression, or rage. And that's something we want to screen for early. Postpartum doulas are these angel people who live in our city and will take shifts, come over to your house for an hourly fee, and take your night feeding so that you can sleep, because sometimes that's all you need is a nap. The motherhood space is an awesome resource to joint venture between the YMCA and Baptist psychologists. Jacksonville is one of 5 cities in the country to receive this grant. So it's all covered for by the grant or by insurance, but they have light therapy, exercise therapy, counselors for group and individual counseling as well. So if you are identified as someone who could benefit from the motherhood space, we'll definitely be placing that referral. And then pelvic floor therapy is standard in our practice. It's standard in many other countries, and we are trying, America. But pelvic floor therapy starts at 8 weeks after you deliver, and it helps significantly with all the other symptoms postpartum that no one talks about: the sensation of heaviness, pain from lacerations and repairs, leaking urine, that all feeling like something's going to fall out. Yes, all those things happen in pelvic floor therapy, helps with a lot of them. So before I get to my randomly frequently asked questions, this is my last baby. Can I request to have my tubes tied after birth? Absolutely. Typically, though, we don't usually do them in the hospital. Because, well, unless you want to be induced and schedule it, but most of our patients don't want to be induced. And in that case, we just do it when you're 8 weeks postpartum. So you can sleep on your left side, you can sleep on your right side, you can sleep on your back if you want to. But if sleeping on your back makes you dizzy, get one of those wedge pillows to go under your back so you're not fully on your back and you're at kind of a little tilt. You can help paint the nursery. Be sure you're in a well-ventilated space or wearing a mask. You can take probiotics, prebiotics, postbiotics, all the biotics they have come up with to get y'all's money. Hair dye is fine, including your eyebrows. Gel nails are okay. If you're in a salon with a lot of fumes, you may want to wear a mask so you don't get dizzy and pass out. Car travel, summer vacations are coming up. You can travel. So up to 37 weeks is fine. Like, you can travel after 37 weeks, but I'm just saying your baby doesn't have a calendar. And if you, like, you're full term, if you go into labor outside of the city, we're not coming. So please, up to 37 weeks, just in case your baby decides to make a surprise appearance at 37 weeks and 2 days. You want to be close to full circle because you want us to deliver you. So be sure you're getting out and stretching, though, every 2 hours if it's a long car ride. For skincare, you can use your salicylic acid, your benzoyl peroxide, anything topical except for retinol. If you need a retinol substitute, bakuchiol, Bakuchiol, is a vitamin A derivative that is safe in pregnancy. Air travel, flight is fine for twins up to 32 weeks with no other issues in the pregnancy. Flight is fine for singleton pregnancies up to 36 weeks, again, with no other issues in the pregnancy. But please, please, please wear your compression hose. Wear your medium compression hose. Drink lots of water on the flight. Like, you should have the aisle seat because you should be getting up and going back to the bathroom so much. And then when you're just sitting in the seat, you want to do toe raises to make sure that you are increasing your circulation and not getting blood clots in your legs. Again, summer crew, no roller coasters, no water slides, no jet skis. It's not on here, but somebody did ask me that last week. All right, last section is about upper respiratory infections. The question is, for high-risk pregnancies, do we have the option to be induced at 37 weeks? There are some high-risk conditions for which we recommend delivery at 37 weeks, but that's an individual thing. So let's definitely talk about that at one of your visits coming up, love. Okay. All right, vaccinations. So again, third trimester boosters, ACOG moved from supporting either way to strongly recommending due to increased ability to passively immunize baby. If you're getting a COVID booster, Moderna and Pfizer are fine. Johnson & Johnson isn't recommended because of its independent risk of blood clots. They're all approved for boosters. So if you're more than 6 months past your second Moderna or Pfizer, you can get another one. If you're more than 2 months past your Johnson & Johnson, you can get a Moderna or Pfizer because mixing and matching is fine. And there's no optimal timing them against your flu, RSV, or Tdap. I don't think y'all are going to be pregnant during flu season this year. Or RSV. It's not like you're trading off being pregnant in the heat. If you do get COVID, there are no recommendations for ivermectin, azithromycin, or Plaquenil. Our number one recommendation, though, is not to come to the office. Please do not get all the other pregnant people in the practice sick and the providers, because if you get us sick, then we run out of appointments because there's no one here to see you. So please convert to virtual appointments. We do still want to check on you, make sure that you're doing okay, but we want to do that without risking everyone here getting sick too. Vitamin D3, zinc, and vitamin C in these doses. If specifically it is COVID, we do recommend low dose aspirin in this dose because we've seen an association of COVID with gestational hypertension. We've noticed more and more gestational hypertension in this post-COVID era. If you do contract COVID, because the hypertension can affect baby's growth, we do start doing serial growth ultrasounds after you are better. Supported course of treatment at home. The website that has all the safe medications in pregnancy also has things for cough, sore throat, congestion, and all of that. They have the amount of Tylenol that is safe in pregnancy as well. You only really need to go to the hospital for upper respiratory stuff if you are having difficulty breathing or a fever over 101 that you can't break with 4 grams per 24 hours of Tylenol. For those of you who had a baby during COVID before, take a deep breath. It's not like that anymore. We are back to 4 visitors. So 4 visitors in the room, plus your doula. Your doula, if she is a certified doula, is not considered a visitor. She's part of the birth team. We're not routinely masking in the room or in labor unless you are actually positive for one of these upper respiratory infectious things. And even if you do test positive, we're not separating you from your baby. We give you an N95 mask and give baby an isolate to protect them from your respiratory droplets. All right, and I will answer these last questions while you look at the message that we are social. Question, I'm getting ready to move. What are some of the things I should avoid while still being helpful? So you move with one finger. You tell people, take that and put it over there. Take that and put it over there. That's how you move as the helpful pregnant person, okay? And just remind everybody, you got a job going on inside of you. You can't do the jobs on the outside. Next question is, I meant to ask earlier, do you consider a certain maternal age automatic high risk? No, it is not abnormal to be 35. It's not abnormal to be 36, 37. These are all physiologic stages of life. What I advise people to be is your healthiest 35, 36, 40, or whatever, because just being 25 doesn't mean that you are healthier than someone who is over 35. So no, it's not an automatic referral to. It's standard of care to offer a high risk consultation, but most people don't accept it because there's nothing they can do about you being 35. Next question, how many weeks would you start worrying about baby's position? So I always tell people, don't worry about it, act about it. So you can start acting on baby's position after 32 weeks. That is when we really want to start looking at spinning babies and other exercises like Miles Circuit to start encouraging baby to turn head down and keep the spine up. Other questions. I think this is the most number of questions I've ever gotten. Like, y'all are my favorite group. Sometimes they let me talk for a whole hour without saying a word. Okay, well, remember, we are social, so follow us on all the things. Thank you guys for hanging with me for this hour. I really appreciate you. And I tell people, as the founder of the practice, if there is an issue with Full Circle, please come to me. You have access to me. Going to Yelp, going to Google, going to wherever to complain about things doesn't actually solve your problem. problem. I can actually solve your problem. So let me know if there's any issue that I can help to resolve to make your experience here at Full Circle better. We are happy you chose us, and we are excited about you guys growing your family with us. Y'all have a wonderful evening. We'll see you soon. Bye.